Good morning. Today I thought I would go over um, where some of the drugs fit and what they can cause. Um, for instance, alcohol is also a depressant. So if you're already having breathing problems and you take or drink, it can cause you not to be able to breathe. Um, Same thing with some of the other drugs, not to mention the liver damage. And it's saying as little as 2 beers can impair your thinking and coordination. So, really need to be careful with mixing alcohol with any of these drugs. Um, it's the most frequently used by the young people as well, partly because it's cheap, partly because it's there. Marijuana can cause short-term memory loss. It can shorten your attention span, delay your reflexes. It's usually abused for relaxation and or euphoria. During pregnancy, it can cause birth defects. It can cause heart palpitations. It can cause breathing problems. Most of the time, it causes you to be relaxed and lowers your inhibitions, which can or can't be good depending on the situation. Inhalants. A lot of people are doing this more and more. Again, cheap, easy access. Some of the things that are being abused are the butanol. For the lighters. Gas in aerosol cans, the gasoline or turpentine vapors, correctional fluid, glue, marking pens, and they can cause loss of muscle control, slurred speech, drowsiness, loss of consciousness, excessive secretions from the nose and watery eyes, brain damage, and damage to the lung cells. So again, it's something to be aware of and be cognizant of. You can be doing permanent damage to your bodies. Another item of concern are steroids. Male hormone are the most frequently abused. Cortical steroids, such as your creams and stuff, and the estrogenic, which are the female hormones. And they're abused mostly because they'll increase your strength, your muscle size, and help muscles recover faster. But they may cause some severe rashes, some stunted growth, acne, sexual function problems. Women take on masculine traits, develop hairiness. Behavioral changes are aggressive behaviors. Long-term effects such as cholesterol increases, heart disease, liver tumors, cancer, cataracts, and death. So again, it's something to be concerned about in the long-term use. Crack is the next one on my list, and it's usually abused because of the quick high, the power, and the euphoria. And crack is instantly addictive. One use could cause a fatal heart attack. Repeated use may cause insomnia, hallucinations, seizures, paranoia. Euphoric effects of crack last only a few minutes. Crack possession and use is illegal in all 50 states. There are more hospitalizations per year resulting from crack and cocaine than any other illicit substances. Next on the list is cocaine, also known as coke, dust, snow, flake, blow, girl. They're abused for the carefree feeling, euphoria, relaxation, having the in control feeling. A cocaine high lasts only about 5 to 20 minutes. Cocaine may cause severe mood swings and irritability. You need more and more each time you want a high. Cocaine increases your blood pressure and your heart rate, particularly dangerous if you already have a heart condition. One use can cause death. Possession and use is illegal and can result in fines and arrests. The next is called ice, also known as meth, crystal, crank, or methamphetamines. It's abused for the temporary mood elevation, the exhilaration or high, the increased mental alertness, and the upper increased wakefulness. But it is extremely addictive. Sometimes one use is all you need. Ice can cause convulsions, heart irregularities, high blood pressure, depression, restlessness, tremors, severe fatigue. An overdose can cause coma or death. When stopping ice, you may experience a deep, deep depression. Ice can cause a very jittery high along with anxiety, insomnia, and sometimes paranoia. Next on the list is hallucinogens. Some of those types of drugs are LSD or acid, ecstasy, which is a designer drug, PCP or angel dust, PCP and cocaine, which is beam me up, Scotty, mescaline, or some of the reasons they're abused are that they're fun, there's the stimulation or depression, and the behavioral changes. But LSD or PCP can cause multiple dramatic behavioral effects. Large doses may cause convulsions, ruptured blood vessels in the brain, and irreversible brain damage. Many hallucinogens cause unpleasant and potentially dangerous flashbacks long after the drug was used. Most hallucinogens cause hallucinations, i.e., changes in the perception of time, smell, or touch. Steroids are the next one. There are synthetic compounds available legally and illegally. Drugs that are closely related to male sex hormones or testosterone. Possible effects are that they increase your body weight and strength, enhance athletic performance, increase your physical endurance. Symptoms of an overdose are quick weight and muscle gains, extremely aggressive behavior, impotence, skin rashes, withered testicles in female, development of irreversible masculine traits. Withdrawal symptoms are significant weight loss, depression, behavioral changes. Indications of misuse, again, are the increased aggressiveness, jaundice, purple or red spots on the body, unexplained darkness of skin, persistent unpleasant breath odor, swelling of the feet or lower legs. I'm hoping that some of this is informative to you. I want you to understand some of the long-term problems with these drugs. So narcotic drugs, opium, morphine, codeine, heroin, methadone, hydromorphone, they're all narcotics. They're used medically to relieve pain, high potential for abuse. They can cause relaxation with an immediate rush. The initial unpleasant effects are restless and nausea. Possible effects are euphoria, drowsiness, respiratory depression, constricted or pinpoint pupils. Symptoms of an overdose would be slow, shallow breathing, clammy skin, convulsions, coma, and death. Withdrawal symptoms are watery eyes, runny nose, yawning, cramps, loss of appetite, irritability, nausea, tremors, panic, and chills. Indications of misuse are the scars caused by the injections, constricted pinpoint pupils, sniffles, watery eyes, coughs, nausea, lethargy, nodding, syringes, bent spoons, needles, etc. laying around. So that's just some of the drug categories and the things that fit into those categories. I hope this was informative. If you have any questions, please feel free to email me. Hallie emailed me and wanted to know about benzos and with tapering off. It's best to be done under the advice of your doctor that prescribed them. It must be done as a taper. It must be done slowly and under the supervision of your doctor. It can cause seizures if you don't do it correctly. So it's very important to coordinate your care with the doctor that's prescribing them. And I checked with Dr. Gresser. That was his best advice. So any other questions, please feel free to contact me, dwood.4@yahoo.com. Thanks so much for listening. Take care. Bye.